Got it. All right. Good evening, everyone. Welcome once again to Words of Pearls. My name is Chang-Ageda, for those of you who don't know. And tonight's topic is health in our communities. And we're here to speak with Dr. Leslie Kernisant, who is the CMO of the Morris Heights Health Center, which is located at 1095 Flatbush Avenue, and it's located between Cortelyou and Clarendon Roads. The hours are 9 to 5 Monday through Friday. On Saturdays, 8 through 4 until 4 p.m. And the phone number, which I'll put in the chat after, is 929-512-3900. And so this is a center where the staff acknowledges that your life is valuable. And we're going to, Dr. Leslie Kernisant will be explaining to us some of the health disparities in our, communities, and talk about, I believe, diabetes and hypertension and obesity, infant mortality, and but won't be just discussing some of the issues that we're facing, but also solutions. And they do have lots of services, and he'll probably more than likely go into them. But I'll just mention they have services offered for women. They're doulas for those who are pregnant. And it's always important that when you find out that you're pregnant at the early stage, that you check in and to have a safe delivery and a healthy baby. We're always concerned about the health of the mothers as well. Services, there are services for families, services for kids, the youth, and mental wellness programs, and a host of other programs. So he'll explain that. But let me just tell you a little bit about Dr. Kernisant. So he is recently the Chief Marketing Officer for the Morris Heights Health Center, which we call MHHC. And he's a professional. He's been doing this for over 40 years now, right? He graduated with an MB degree from Howard University of Medicine, and he has held many teaching positions. And some of his positions that he's held are, he's been the director of the Department of Obstetrics and Gynecology of HIP of Brooklyn. We've all know about that. CEO and chairman of Preferred Health Partners, PC, executive director of clinical practice for New York, largest private multi-specialty physician group, Advantage Care Physicians of Emblem Health. And he retired. However, he's always concerned about the health of our communities, the health of people first, right, is the practice. And so he continues to work with various health centers within our communities for, to establish and to ensure that our residents and the members of our communities, our families and ourselves, that we're not just simply rushing to emergency room, but that we're living healthy lives. And so the center is there to help, to guide, and to have folks check in, and they offer various programs. They recently did a program to teach mothers about infant deaths, so SIDS, so that how to keep your baby safe so they don't die in their sleep, and a lot of other programs they've had. They have a program for the seniors to stay fit, to exercise, and many others. But I'll now turn it over to Dr. Kernisant. So welcome, Dr. Kernisant. Thank you for joining. And
thank you. Thank you, Florencia, for such a very comprehensive bio. Of all the titles that I've held, none is more important than what I'm doing right now. I have to say, quite frankly, I've been practicing medicine in Brooklyn for almost 45 years.
Mm.
I started as an OBGYN. I used to deliver babies. I must have delivered over 4,000 babies in my lifetime. And subsequent to that, I decided to wear the second hat. In medicine, you wear the first hat, which is the doctor. As a doctor, you tend to at least know the emotional toll of illness in a community. And as an administrator, you tend to at least analyze the magnitude of such problems. Let me start with the first one. As a doctor, I will tell you quite frankly, I had to look for an organization that is good enough to take care of the major health problems that I encountered in Flatbush. And I was lucky to be appointed by the CEO of Morriside Health Center. For those of you who have not heard of Morriside Health Center, let me try to explain to you. This is not a new organization. It may sound new, but it has been in existence for almost 40 years. They are headquartered in the Bronx. They have 35 other sites in the Bronx. The Flatbush site is really the first embedding into the healthcare environment of Brooklyn. When I called them, I explained to them that I went to school in Flatbush. I went to school to the old Wingate High School, close to Erasmus. I can tell you it's a community that is very well diverse. We have a strong group of immigrants. In fact, 40 to 45% of the East Flatbush population happen to be immigrants, mostly from the Caribbean. Additionally, you can imagine, in addition to the stress of being in a minority community, we also have the immigration stressors. Immigration stressors meaning that xenophobia, of course, afraid of being deported, and also the cultural obstacles, such as language barriers and so forth and so on. In addition to that, we happen to have a community where the chronic conditions are quite severe. To give you an example, when you take in terms of hypertension, in Brooklyn, we already have a high rate of hypertension, but in Flatbush, it's almost 36% as compared to 28% in the rest of the city. When you talk about diabetes, diabetes is even worse because we have almost 16% of our population have diabetes when the rest of the city is really between 10, 11. And the main reason has to do with the fact that most of us do not really know that we have diabetes. In fact, there's a special type of diabetes that we call the Flatbush diabetes. It was discovered by a group of physicians from the downstate that find out that most of the people in Flatbush who end up having diabetes find out at the late stage when they end up in a hospital for what we call diabetic ketoacidosis. This is a stage of the disease where you are almost passing out. So you end up in the emergency room, and that's when they find out that your problem has to do with diabetes. Now, addition to that, we have to also be concerned about maternal health. Maternal health, all mothers die at the rate of almost 3 times that of white people. Or infant mortality is almost twice the rate of white people. When we talk in terms of preterm, in other words, having your baby before your term, it's almost 10%. The rest of the city is approximately 5%. So you can imagine what I had to face when I decided to call Morrisides and ask them to help change the poor health statistics of Flatbush. Now, again, I have to admit, Morrisides not only provide good quality, but also they also take care of what you call the social determinants of health. when you talk of health, we always say wealth means good health. Poverty means guaranteed sickness. So that is our problem right now. We have to make sure that at least we have a community that we identify the problems, we try to resolve the problems, but at the same time, we try to prevent them. The social determinants of health are what? Having, been able to have access to healthcare. And that is why we place one big center, almost a 22,000 square foot center, at the corner of Flatbush and Cortelyou. This center has the capacity to treat between 100 and 200 patients a day. Right now, we are in the starting phase. We are trying to ramp up the patient volume. That is why I want the community of Flatbush to know that we do exist. Now, with respect to what we think should be done, our first analysis find out that in addition to poverty, 20% of our people live below the poverty line. Housing, obviously, we have a very concentrated type of housing. I mean, you can live in buildings that are probably 40 families. It's okay, but certainly it's also a sort of an environment that fosters contagion. In other words, infectious disease. We just went through a pandemic. You know what that means? When you get into the elevator, you have 15 people in the elevator. Those are the conditions that we are trying to at least improve. Education is another way. There's no way you can treat without knowing what you are treating. The patient has to know exactly what's wrong with him or her. Additionally, we have to also concern about insurance. You can have access to healthcare, but if you have money, you cannot get there. We also are concerned of that, and we invite everyone with or without insurance that our primary focus is not the money, it's your health. So we're not really a profit-seeking type of organization. We are an outcome organization. We are more concerned about how can we change the hypertensive rate from 36 to 26? How can we change the diabetes from 16 to 6? How can we make sure that our mothers can carry their babies full term? So these are the things that we promise you we will do. Now, as you know, I don't have to tell you, there are certain communities that are lucky. We call that the health equity communities. They have the money, they have great housing, they are well educated, they have insurance, and they are culturally well adapted. Flatbush, what we have a community that is really cash poor, crowded housing. A lot of them are not even well informed. 20% are not insured, and they have the so-called cultural barriers. They have language problem. How can you go to a doctor if you cannot understand what the doctor is telling you? So these are the things that we have identified. And this is why we are telling you, if you look at the lifespan of someone in the minority community and the lifespan of somebody who is not part of our community, it's a hell of a difference. For example, if you take Brooklyn, I don't have to name communities that you know or opulent community. I don't have to mention them, but we know our communities. We know where we are from. We know East Flatbush. We know Brownsville. We know part of Bed-Stuy. We know. When you compare the two, there is a markedly different aspect. A person in those communities who have health equity live to be 83, lifespan of 83. Our community, if you make it 74, you're okay. But we still have, we may have those that live even 65 or even 55, because what kills them are the stressors of the environment, the stress, the hypertension, the diabetes, the concern for rent, the cultural barriers such as language and so forth and so on. So in a sense, what we promise to do for you, all right? What we promise to do for you is to give you everything that you're missing. We want to give you access. We can give you affordable care. You don't have to worry about the cost. We want to make sure that we help you get insured. We want to make sure that we give you a sort of a translator. When you come to us, if you cannot speak English, if you only speak Creole, Hispanic, whatever, we will definitely take care of you. And we are definitely there for you. And now I will probably stop there to listen to the questions, and we can always continue the conversation.
Okay. Well, I was looking to see in the chat. I didn't see anyone put any questions, but I'm glad you mentioned about the insurance, because the reason why you're able to write, you're federally as well as state funded, aren't you?
Right. We are. We
Okay.
definitely are. And the problem with when we say federally funded, you have to really understand that federally funded, that doesn't mean we are a truly 100% free clinic. There's no way we could have done it.
Right.
Because to provide quality of care, we have to make sure we buy certain services. For example, if we have to get the best qualified providers, we have to be a little bit competitive. And right now, with the post-pandemic, healthcare personnel is almost gold. Nurses are making money that when I was an intern, I used to make. So that's basically how things are. So we do feel that it's not a free clinic, but we do get some federal help. And the federal help is not really 100%. It's mostly between 20 to 30%. So we have to work to at least meet the rest of our budget. That can be almost 70% of the actual cost. The problem, we always tell people, we are a mission-driven organization. Our primary focus is your health, the outcome of our treatment, prevention of disease. It's not really profit to give shareholders or to give to people who are job seekers. We are practice builders. That's what we are.
Thank you. Also, so what about, as you talked about the pandemic, and I know within our communities, there were many who lost loved ones. There are many who are going through difficulties. Children are going through difficulties. So what kind of program do you offer for mental wellness at the Morris Heights?
Oh, definitely. Part of the Morris Heights curriculum of a menu of activities, they have a very large component that deal with the mental health. As you know, mental health is almost a sequelae of anything. The pandemic, the bad divorce, poverty, the stress of an immigrant. Definitely, it will be almost impossible for us to have what we call a medical clinic without having the major component of illness, which happens to be the emotional toll of those social determinants of health. So yes, we do. We have not only social workers, we have mental health workers. We definitely have a network of referral that we can certainly refer these patients to our centers in the Bronx, but also we are now in the process of building up the staff infrastructure. Right now, we just started 5 months ago, but ultimately we intend to have a fairly robust structure for mental health. So please come to us with your mental health problem, and we definitely will convert them into good physical health.
Yeah. So another issue that I became aware of in recent times is the mortality rate of pregnant women. And so one of the things that I was glad that you mentioned, because I've visited the facility, I referred someone there, and they came back to say how The staff was very proficient as well as professional, very caring, because they actually lost the baby, but the staff was, you know, had them in her words, she was in a good headspace. And
Oh, yeah.
the doctor who spoke to her, you know, was very comforting and just helped her through the rest of whatever she had to go through, the surgery that would have followed. So, is there any way you can talk a little bit about the doulas
Oh,
and
yes,
what kind
definitely.
of a
Well,
program?
one thing, I mean, I will try to address your first your reference to our staff. As you know, when you work for an FQHC, the primary focus, again, I mentioned, is the mission. And what is our mission? Our mission is that we always place the patient at the center of our activities. We always make sure that quality is number one for us. The fact that we can provide you everything that makes it look like, although we are giving you free things, we also care about the quality of care. The quality is very important. In fact, as an FQHC, we are the most almost regulated type of organization, simply because we have to prove to the government on a yearly basis that our stats are getting better. We have to show improvement, because
Right.
nobody will give you money if you continue
True.
to get a very bad report card. So a report card has to show improvement on a yearly basis. So as such, this is the driving force that keeps us open. Now, with respect to maternal health, as you know, I'm a gynecologist. I
Yeah.
practice obstetrics and gynecology all my life.
Yeah.
When I left Brooklyn from high school to go to medical school, I was only 17. When
Mm.
I got back, I became a full-time doctor at the age of 28. Since then, I've devoted my life to make sure that my pregnant patients get a nice baby at the end of the pregnancy. Unfortunately, not too many women can say the same thing. A lot of them end up having lost their kids too early. When they go to have a baby, they have a very high chance of dying as compared to the white counterpart. As I mentioned, the maternal mortality is 4 times as high in Black than white. And to be truthful with you, even though we always associate maternal death with just poverty or Black, but it has nothing, it does have a lot to do with it, but even the educated Blacks are being treated unfairly. Even if you are a PhD and you're a Black woman, you may end up in a
Yeah.
hospital where, because of unconscious bias, the way they treat you, they don't even trust you. So that is
Mm.
why we make sure that Black women make sure that we provide you with culturally sensitive providers. Now, having said that, what are we doing to Maurice Heights? We realize that part of the problem in a childbirth is that when you are pregnant, pregnancy should be a nice journey, a family journey where everybody's happy. But for the Black woman, unfortunately, it is really not. For the Black woman, you can imagine, when you're pregnant, there is a fairly chance that you may have bad outcome. It's not only death, you may also have what you call complications. You know why? Many of us, we started the pregnancy journey with a number of chronic conditions.
Mm.
Start the journey with
Wow.
chronic hypertension. We start the
Mm.
journey with undiagnosed conditions because we've never been to the doctors, right? So by the time you're pregnant, pregnancy is a stress on life. Pregnancy gives the body a stress that you never experienced. So a lot of women end up dying at the time of delivery. 17% of all delivery of all maternal death occur at the time they are delivering. They have high blood
Mm.
pressure, they probably didn't know it, they end up having bleeding or cardiac arrest,
Oh,
right?
wow.
So, And at the same time, not only at the time of delivery, at the time of postpartum. And that is why we initiate the idea of a doula. What the doula does. The doula does not do anything clinical. The doula is a professional. Is a professional, what you call, she helps the patient go through the stress of labor, to the stress, not only the labor, the stress of the entire pregnancy length. The doula does not see you only in the delivery room. The doula see you before, see you after. So the doula is always there with you. That's what you call a full maternity service. So that is what we are offering. I think we are probably one of the few healthcare organizations that before we do anything, we had hired 2 full-time doulas. They are with us now, even though we only have 11 patients who are pregnant, but we have 2 doulas ready for the big one. When we get 100, we probably will have 4 doulas. So we have doulas. So that's basically the main purpose of the doulas. The other thing that we have done, when we do our studies, we find out that when a woman gets pregnant, a Black woman, you go to what we call a community health clinic. A lot of these patients are not being delivered by their doctors at the community health clinic. They do the prenatal, and they go, when they go into labor, they call the ambulance take them to any hospital. It could be Woodall, it could be Kings County, it could be Downstate. And you can imagine an 18-year-old pregnant being followed by a doctor, and then the big day, because the pregnancy is preparing you for the big day, which is the delivery day.
Right.
And you have no one in the hospital helping you. That's the purpose of a doula. So doula, I think the doula is the familiar face that tells you, hey, I'm with you. Remember, Dr. Ugoku took care of you? I was with Dr. Ugoku and that is so reassuring on a pregnant woman. And this is the idea of doulas. Whether it costs the organization more, it doesn't matter. What's important for us is the result. It's for us to have a patient who was pregnant in December come back to us in January and say, here's my baby. And by the way, we also are organizing the idea that our pediatrician will ultimately go to the hospital and see the baby the first day. So that's what we're offering.
Wow. I love that. That's really a great thing, because I remembered when I had my Maimonides, the pediatrician was there. So,
right, that's important. That is important. That is important. The idea of having your entire, without having, in the event that the obstetrician is not there, but if the doula is there, the doula will come back to me the next day and say, well, you know what, Linda delivered it, and I can call Linda, and that's so reassuring. That is what you call giving the full maternity service.
Yeah. And I'm really grateful that this kind of service is being offered within our community, because, and it gives a pregnant woman more confidence.
Oh, yes.
To say that the outcome will be great.
And that is why the difference between the health equity neighborhoods and the health inequity neighborhoods, because the health equity neighborhoods, I think, rarely will not have their own private doctor. The wife will not get into the hospital and say, who's this? No. And we want to offer the same service in a way that at least is very cost conscious. We're not going to break the bank, but certainly give you a sense of being cared for.
Yeah. You want the doctor who took care of you to deliver your baby.
Exactly.
In my situation, only in one of my children, the doctor wasn't there, because my doctor was all the way out in Long Island, and it was like an overnight situation, but then I had the baby. So
right. Well, in my lifetime, I've been away at least 2 or 3 times. And when my friend delivered my patient, I sometimes, even if I was out of the country, I'll give a call the next morning. That's so reassuring.
Yeah. Oh yeah. Oh, my doctor called and she came.
Exactly.
But
So it's to
the
reassure.
thing is, she wasn't there at the actual time of delivery, is what I was saying. But the others definitely was my doctor delivered my baby. So,
Right.
and it's reassuring because with my daughter, she had the cord around her neck,
Right.
and it was, he said it to me before even, me delivering. I'm like, he was an older doctor and he knew
Oh
and
yeah, yeah.
knew
Well,
what to
we
do.
do know now with the power of technology. So now that
Yeah,
prior
yeah,
to delivery, we certainly can do that now.
yeah. But I'm grateful because he really took care of. I listen. I had no clue. I felt like nobody was in danger. We were in great hands, and
Right.
so and with the help of God, I was confident. I seriously wasn't concerned, but it is great to know
That's
that
right.
women within our communities are being offered that, families, even if she's married, so her husband doesn't have to worry. And as you said, it's not just lack of income, it's not just poverty. There are educated women, there are women, but living within certain, as you said before, unconscious bias can play a part, and we've heard of
Right. 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 Definitely.
unfortunate,
Definitely.
outcomes. But we're thankful that Morris Heights
Oh,
Health
definitely.
Center is here. Now, I wanted to, oh, if you had something to say, go
No,
ahead.
no, 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 no. Go ahead.
Now, I wanted to ask, so do you utilize like therapists that are in Brooklyn? Because I think I heard you say, I know that there are other sites in the Bronx,
Yes.
and that's
30,
where the
30
headquarters
sites. Yes.
is, and where, it was born out of, and this is the first
Right.
center here in Brooklyn and within our community. So uh, if there aren't enough therapists there, or they need to be referred, would they be referred to the Bronx, or have you made
Well,
alliance?
no, what happened, as you know, every time you open a brand new practice, what you call the startup practice,
Right.
there is a phase. The initial phase is usually the so-called the core specialties. In other words, the core specialties are what we call the basic primary care physicians. And right now we are adequate. We have internal medicine, adult medicine, we have a number of pediatricians, we have a number of OBGYN. Okay, we have these three. We also have a social worker to make sure we identify the mental health issues. Right now, the fact that the mothership is in the Bronx,
Mhm.
okay, they are helping us going through the challenges of the initial phase. But the idea is we are building our staff infrastructure. Within the next 3 or 4 months, we probably will have additional to that. We'll have a podiatrist. We are building a dental suite. We're going to have our lab. We're going to have a number of nurse psychiatrists. So this is something that is coming. You're now at the first 3 months of the construction phase. And then next year, when I speak to you, I will say, well, you know what? I don't have 7 providers anymore. I have 40. Because I used to be the CEO for HIP,
Yes.
and I used to run 12 fully staffed centers in Brooklyn. So I know how to build them. And this is going to be almost as if you are going to experience the same thing, because we're not going to stop there. We want to be known as the Morris Heights Health, the same way people, when they hear about Northwell, they hear about Maimonides, they hear about Mount Sinai Clinic. Because when you go along Flatbush, you see how many Mount Sinai Clinic, you see how
Yes.
many New York Legume Clinic, you see how many New York Vegetarian Clinic. Nobody says anything. But Morris Heights is going to be as big. The big difference is that we are not the profit seekers. We are
Mm.
mission driven, and
Yes.
we care about outcome.
Yes. 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 And I'm glad about that, really, because we need that within our community, and for our members to feel safe. Now, I know that, and to be, I attended one of the presentations, and I remembered there were some patients who gave testimonials, and I thought, just hearing them speak from their hearts and to know that they are really blessed to have Morris Heights Health Center, I'm like, that's a great start.
Right, right, right.
It's one thing when those who are in charge are telling you, but when you actually have the patient saying, wait a minute, then and as you said, word of mouth really does help.
And also we do believe in following the so-called the Healthcare Reform Act that accentuates to the three main pillars of good health, of good practice, good medical practice. It happens to be quality. We spend a lot of money for quality. We make sure that your equipments are modern. We make sure that at least we check, we have a check system, we have a quality review process to make sure that the doctor is doing what is accepted in terms of national standards of care. Secondly, we are patient focused. We call ourselves patient centric. Everything we do, it's for the patient. Our staff know it, the doctors know it, even the guy who's cleaning the floor know it. So that's what we do. Third, we are very much cost conscious, because the problem with saving money in healthcare is not reducing care, is by avoiding wasteful practices. Wasteful practices, which mean that I'm sending for the test just in case. We don't do that. Right? So we follow these three three concepts, and definitely we feel that we are going to be there for a long time. We're going to be truly the center of excellence.
Yes, and I see, I've been there. I recently saw, I came back, I've been there more than once. And so I recently saw a mural, and I have to say that I find it to be very clean establishment, very peaceful. And the staff is, as I said, and I've actually recommended folks there because of what I've seen. I remember someone was in one of the bathrooms, and it was after hours, like a little bit in the afternoon. Yeah, and there was an event. And so the bathroom, the emergency button went off.
Right.
And you would think that maybe folks would say, well, it's not a patient, therefore I won't respond. It's fine. But no, that they responded just the same, as if, they didn't like take things for granted. It could have been an emergency situation.
I know.
And so I really appreciate that. And that says you care about people. That's what I'm trying to say.
Okay.
So I appreciate that. What are some of the programs? Because I know you have various programs. You have exercise programs for babies. So can you, share some of the programs that are there?
Well, basically, there are programs in conceptual stage, and there are programs that are now available.
Mhm.
For example, the wellness is something that we are working with not only with our doulas, but also we have invited a number of health experts, physical health experts, to make sure we not only teach patients the value of movement, because 50% of the people in our community do not participate in physical wellness.
True.
And we are trying to sell of that.
It's very sedentary.
We have had a number of sessions already. We do have, but ultimately the goal is to really have a room there where we probably can do it almost every day, if possible. But for the time being, we try to invite people to at least organize certain sessions. But going forward, the plan is to make sure physical wellness is an integral part of health. You cannot stay put. You have to move, because that's the reason why people develop stroke. the people develop what you call clots, is because the blood is not moving. The blood stay in your leg, and you end up having what you call DVT, deep vein thrombosis, and that's the killer. Yes, we definitely accentuate a lot on the. Ultimately, we are hoping that we can even consider having another place for physical therapy and things of that sort. But for the time being, we definitely educate our patients as to the value of doing physical activity on a daily basis.
Yeah. That would be really great, having, the center for the physical therapy.
Definitely.
However, so in the meantime, though, are there classes being offered on hypertension and diabetes, or have you in any way reached out to many of the churches? Because we know that a lot of times there are many churches, maybe not the Seventh-day Adventist churches, and even in the Seventh-day Adventist churches, we all need. There's you have the one, what's that, Flatbush SDA, you have MES right there, and what's the other one? There's another one on Ocean Avenue that's also part of our community.
Right.
And we know that there are a lot of times that the meals that are served in some churches, like the mac and cheese and fried chicken,
Right.
and it's not that you can't eat some of these in reasonable portion, or so I'm just saying, are there plans to
definitely
expand into churches and just give some, maybe like an afternoon class, or or symposium or something?
Oh, definitely. Part of our plan, I mean, again, I'm talking about plan because the phase that we are in is education. Education is very important to us. There are two types of education. There are education for the providers. We require that at least they take certain courses to stay in shape. At the same time, we also ask our providers to help us educate their community by going to churches, by going to clubs, by going to other professional organizations, and we do that. We have had certain lectures given at our place. I gave a lecture on breast, at the on the value on breast cancer. We intend to give classes on diabetes. I did one. I've to several churches where I've spoken to a lot of people about health, and definitely it's something that we will be doing on almost a monthly basis to make sure that the communities are. Yesterday, we had a sort of a roundtable conference where I invited a number of physician leaders in the community. Some of them have been working in the community for almost 25, 30 years. And we decided that from now on, we're going to keep that group. It was almost 6 of us. There were 2 gynecologists, 1 pediatrician, 2 internists. We made a decision that we're going to, from now on, start having a program where we will teach the community about diabetes, about hypertension, about obesity, about maternal health, and ultimately we will definitely have a huge session about mental health. So these are the 5 things that we will be doing.
Yes, and that's very needed. And if you notice, sometimes on Flatbush, there are a lot of folks that would walk out into the road right across.
I know.
I tell you, there are quite a few right in that area. Like when I drive through or I'm walking, I see that. So yeah, we definitely do need the Morris Heights Health Center. And I was also thinking about, oncologists or giving a lot of times with diabetes, that can also be like the onset for other,
right.
So that really, really honestly do need to be addressed. And, and we're in an era where so many people, there are so many different types of cancers, and not that we're focusing on the negative, but I loved what you had said, and the CEO, it's the prevention. And an ounce of prevention is better than a pound of cure.
Definitely.
And so that's why I'm glad that you're doing what you're doing, and you've taken a proactive role, and that will help our communities, really,
Yes,
in our future.
and the very nature of our program, the very nature of our mission is really to prevent disease. In fact, the things that we at least measure on a yearly basis are things that are preventive. We want to know what percentage of people did we do a mammogram for. That's prevention.
Right.
We know what percentage of people we do a colonoscopy for. That's prevention of colon
Yeah.
cancer. We know what percentage of people who are immunized. That's also a prevention of diseases in young kids and so forth and so on. So and what percentage of people who do pap smear? That's also prevention, cancer to cervix. So
Yeah.
basically, this is really the core of our practice, is to make sure it's better to prevent than to treat. We will treat, but we emphasize prevention.
Yes. And I'm glad you said that, because, something that I wasn't aware of but was brought out, and I've spoken to other folks, that is the emergency room is where some folks use as their doctor, but the emergency room says that something has gone horribly wrong.
Oh,
And
definitely. Well, the reason is simple. Uh, One thing you have to realize, when I was a young doctor, I used to cover emergency rooms. And most of the time, the people who go to emergency rooms are usually people in that category of health inequity, people who cannot afford it, who are not insured, who cannot, et cetera, et cetera. So when after a while, one of them told me, you know why? When I go, every hospital now is trying to create beautiful emergency room. As you know, they spend a lot of money, a lot of them.
yeah.
You know why? Because they want to attract patients. Patients wants to go to a place that is welcoming. And that's what we create at the Morris Heights.
Mm-hmm.
Okay. We can compete with any emergency because we are as welcoming as them. However, the main reason why they go to the emergency room is simply because they don't have 20 to 25% of our people do not have what you call a primary care provider. They don't have anybody to call and say, well, I'm having a little pain. What do I do? They just have to go to emergency room. We are not saying we're going to replace the emergency room, but going to
Right.
reduce the travel into the emergency room. We want the emergency room to be used only for the true emergencies. And
Right.
usually these true emergencies go to 911.
Yeah.
We're not walking into it. If you can walk into it, we definitely can
Yeah,
see
that's true.
problems.
That's true. Emergency rooms, like when there are accidents, unfortunately, and God forbid, or things, that, yeah. So, but
Right.
really, so we've talked about the disparities, and now you've heard what the center has to offer and the doctors that are there. Oh, what hospitals are you affiliated with? So,
Okay. We are affiliated with several hospitals. Obviously, we are close vicinity to Brooklyn Hospital, downstate. And obviously, we respect patient choices. We do not want you to go to a hospital if you don't want to go to, because there are certain things that we don't know. You may have had your mother who died at a hospital and you don't want to go there. So we are very flexible. We do not have the rigidity of saying you have to go here or there. However, we make sure that our physicians are privileged at several hospitals so the patient can have a choice.
that's good to know. That's very good, because I remembered when my mom was had to go to the hospital. She went to the Kings Highway Hospital, but her doctor wasn't affiliated there. But you know what? He came.
Of course, of
He
course.
came. He was there and there throughout her 7 hour surgery. And I appreciate that.
Oh, no, no, that's a concerned doctor. In other words, the fact that you don't have privileges at a hospital does not mean that you cannot go and make a social visit with a patient that you love dearly.
Yeah. He was affiliated with Maimonides, but
Right,
then the ambulance had taken her there
right, right,
it was closer.
right,
So I don't know, whatever it was, that was
right.
where she ended up. But I just, so things like that is important to know.
Very.
I'm really glad. And for those who are listening, to hear that you have a choice. Because not gonna lie, when I heard the Brookdale mentioned, I was like, oh no. but, but then I heard Brooklyn Hospital, which is where I had my daughter, and I was like, okay. And then I heard downstate, and so it's great to know that your doctors do have the
Right.
flexibility in that you're not rigid in that this is the only hospital you're affiliated with. And not to say, so I'm really truly glad that okay, so what about men? Because I know it's Women's History Month, and we talked about gynecology, we talked about all the female.
I mean, if you remember the old program under Marty Malkowitz, Take Your Men to the Doctor.
Yes,
Yes,
I do.
I was the main organizer for it with Marty
Oh, wow.
Malkowitz. And
Oh,
and so,
thank
so
you
I
for that.
do I do believe in equality, sexual equality, because the problem with men now, prostate cancer is high in women, in men, in Black men in particular. Colon cancer is the same. Certainly, we have a doctor who is coming this week, in fact, to do what we call a cancer screening for men, dedicated for men only. I mean, which means that we're going to do the prostate, the colorectal, and so forth and so on. So yes, we have a very big women's service center, which is probably one of the best, because now when we say comprehensive care for women, we mean that if the woman has a breast issue, you have a cardiac problem, you have you have infertility, you have menopause, it's a one-stop shop. You can go to our women's service and we'll take care of you. The same way we want to establish what you call a system where men can also have their cardiac problem resolved, their prostate examined, their colorectal examination done. So that way we will, balance the sexes. We don't want to favor one or the other. We want to make sure that everyone is taken care of, and the kids are even better. We have two pediatricians who make sure that they are well immunized, make sure we explain to them the danger of lead poisoning, and so forth and so on. So asthma is very high in our community, almost 20% of our kids. In fact, if you think about it, there are 70 per 10,000 hospitalization for Black kids,
Wow.
as opposed to only 6,000 per 10,000 in other communities. So
Wow.
this is a problem for us. So we are definitely taking care of that.
Yeah. So I would request that whenever, after you've organized the program for the men, if I can get the flyer so that I can distribute
Definitely.
that.
We definitely.
Because a lot of, on my block, there was a young man who had diabetes. I didn't realize he had diabetes until I saw his leg one summer. And shortly after that, he actually lost the leg. I haven't seen him recently. I don't even know where he is. I hope he's okay. I haven't seen his family members, so I didn't have anybody to really ask about him. But uh, you know,
That is part of
so
education.
but that's the point I was going to say, because
Right.
like as a young person, I never expected like to see him in that situation. So, and as you talked about the rate of asthma, and so are those environmental stressors? Is that the food? What is
Well,
that?
well,
Well,
the rate of asthma is directly related to air pollution. For example, when you live in a place where there is a laundromat next door to you, there is, air pollution, living in an environment where the air is not purified is one of the main causes. And that's why we tell parents, please, if you smoke, remember that your kids can also inhale the smoke. So secondhand smoking is bad. So this is again part of the education, even the diabetes. Why will someone lose the leg? It's simply just like I mentioned to you, the Flatbush diabetes. They
yeah.
only discover when it is really bad. I went to some of the restaurants myself, and I keep telling them, why don't, this has a lot of carbohydrates, this has a lot of sugar, and they said, well, this is what I know. I mean, I went to a place the other day, and I said, how come I see every soda here is very sweet? At least, not that I believe in diet soda, but certainly it helps control the sugar. And the guy told me, well, if I put diet soda here, nobody is going to buy it. So it's become a business thing. And I said,
Yeah, it is.
you know, so
Can we reach
that's the
out?
education part.
Can we reach out to the the beverage companies and say, hey,
Exactly. Maybe that's
can
probably
you
what we will do.
lessen the sugar content? Those
That's probably what we'll have to do. But if you look at along Flatbush, every soda, if you look at the sugar content, it's very high. And unfortunately, the taste buds of our people seems to favor sugary drink as opposed to non-sugary drink. So this is part of our education. This is why I'm engaging the community to come to us when we send out this community outreach program where we educate on hypertension, diabetes, and so forth.
Yeah, like I have gone to certain events, in, as you said, in health equity communities,
Right.
where when you serve dessert, usually there is tea, there is coffee, and
Right.
water.
Exactly.
And in ours, there are
There's no
times it's
choice. There's
juice,
only one choice.
it's juice, it's sodas, and you have cakes. I'm
Exactly.
talking about desserts. So it's
Exactly. And you
like,
can imagine if you're a
where's the
diabetic,
water?
if you are
Where's the
if you are a diabetic, that's combined as a poison pill.
Yeah, so we really need to
Right.
do a lot more to, and I'm truly glad that you're here within our community doing for our people because it's needed. It's really, really needed. And so is there anything else you have to share that I know I'll be looking forward for the flyer for the man.
Oh,
Anything else? Any
definitely.
upcoming events or anything that
Definitely.
anyone needs to know
Well,
about?
we do have events all the time. A lot of them are in the planning stage, and I'm glad that we have you. Once we have them, we definitely will send them to you so you can at least publish it for us. We definitely think that was a very good first introduction to health disparity, and I will be there to make sure that you see me again.
Okay. I want to thank you so much and just to know that this Morris Heights Health Center is right there. It's easily accessible. The bus stop is right there. As a matter of fact, the bus stop is on the block when you're
Right,
going to the
1095.
north. When you're going to the south, it's across the street. And so it's easily accessible. You can walk, you can drive, you can ride for those who cycle. And you do
Right.
have a parking lot, don't you?
Oh, yes, we do have a limited parking lot.
Oh, well, it's
It's
limited.
limited.
Okay.
Uh, but the hours are now, as we start, we are open 5 days, I mean, 6 days a week, including Saturday.
Right.
We open 9 to 5 every day, with the exception of Saturday, we are 8 to 4. Ultimately, once the patient volume warrants, we're going to open late evenings on Thursdays and Tuesdays. So when those
Oh,
things are operational, we'll send you a flyer to let you know that.
so there you have it for those who have to go to work and you get off work,
Right. We'll
then
be open till 8 p.m. on
they'll be
Thursdays.
open until it rise. So that's good to know. So for all the women, whether no matter what your age is, and if you're, you need an OBGYN, you need to get your pap smear. And listen, nobody's paying me for this. I'm just speaking. I've been an advocate for people within the community, and I will advocate advocate for the young as well as the old and the in between. So I used to be a teacher and I used to be mom, and I would get information, give to the kids because, as you said, I was seeing a lot more kids develop asthma. And when I remember something I noticed is that when they have like a bad outbreak of eczema, like if it flared up, usually like an asthma attack would follow for the kids that
Right.
were asthmatic.
That's the stress, yes.
Yeah, and it's something that I just would, and I
Right.
would when I see a kid that was, I would automatically say to the nurse. And usually before the day was over, they'd have to call the ambulance. So
Right.
it's, it's something that I noticed. And but we have to, and my grandmother taught me an ounce of prevention is better than a pound of cure. So listen, and it's good when you have a doctor that you can trust. That I know, because my doctors were, when you have a doctor that you can trust, that you can talk to, I remember visiting my doctor once to introduce my cousin to her, and she said, "I don't like how you look." I'll never forget. She's like, "I don't like how you look. Come, let me check your pressure." And sure enough, my pressure was elevated. I was walking in the sun. I'd eaten. And this is true. I bought a patty from Flatbush Avenue, and it
Salty,
was so salty.
salty.
And my pressure was, and drank some soda with it. But thank God
Right.
I don't have to worry about diabetes.
Yeah.
But now I watch my intake of salt. And I noticed, as you said, I've spoken to some restaurants, and I have to be thankful that some of the restaurants that I've visited, that they would, because they would make the white rice salty and the meat is salty. And there's no need. You don't have to add the salt or that much salt. So it's good that if we can get our restaurants, our bodegas, a lot of bodegas are selling, the greasy sandwiches that the kids are buying. And if we could just lessen, it
Right.
can help. I think we all need to work together, and it doesn't mean that will stop your income coming in. I think a healthier society is a more productive society. That's what I believe.
Definitely.
So I just want to say. So if you have any closing remarks, you can
Well,
give them to
of
us at
course,
this time.
we have gone through the entire list of uh, conditions that we intend to tackle this year. Again, I will repeat: the rate of hypertension should not be what it is. The rate of diabetes should not be what it is. The rate of obesity should not be what it is. The number of kids going to a hospital for asthma should not be. The number of our mothers who are dying should not be. So our mission here is to make sure we sing a different song next year, a happier song. Basically, our focus is you, not the money. We practice prevention. We would like to cure diseases, but we prefer prevention. At the same time, we definitely are looking at outcome, not profits. So that's the key in our success as an organization for 40 years.
Well, I want to thank you, Dr. Kernisant, and I call Morris Heights Health Center. Now, nobody told me to say this. I think it's an oasis within our community, and I'm grateful that it's there. And for the people who have referred, they have come back with glowing, and they're good and they're happy. And I just want to have our communities healthier, because I believe a healthy society is a community is a more productive society, community and society. And as you said, the communities that have health equity, they do a lot better. And so, we're advocating, and we have to work together. No man is an island. And I really do truly want, you know, as the scripture said, for you to prosper and be in health. Notice it said prosper and be in health as your soul prosper. So we have to be holistically healthy. We have to have mental wellness, health wellness. We have to have physical wellness, and we have to have financial health wellness. And so we're grateful for the elected officials that work with you. And I think Councilmember Rita Joseph and Congresswoman Yvette Clarke, right?
Right.
They do, have made contributions towards having some of the programs that you have. And I do hope that you get even more financial help, and so that to be ready for the influx of those
Right.
who will be coming in. So,
Definitely. That's good.
so that you can have all the staff that is needed to handle And I'm really, truly glad that the doulas are there, you know, for pregnant women and, you know, for all the services that you have to offer. So I want to thank you. I want to thank Miss Kay Lawrence and your CEO. Could you tell her name again?
Marie Millette,
Marie Millet.
who has been in the healthcare business for well over 45 years, and she's still at it.
She's still at it. So we want to thank her and Miss Kay Lawrence, who's the site administrator, and India and all the others. And I want to thank you so very much for giving this in-depth interview. We have a plethora, we have a wealth of information. And I want you to join with, you know, and see in what way we can work together, and men, when their program is set up for you, please
Definitely.
come out in droves. Take your brothers, your uncles, what women, get your brothers, your husbands, your boyfriends, girl, you know, just get them, everyone, direct them there. All right. So I want to thank you very much.
Thank you. Thank you.
It's been a pleasure.
Thank you for the invitation. Thank you.
No problem. Have a good night. So
Okay.
good night, everyone. Thank you.